For the XJ, we're going to look at the patient, do a primary assessment, scene assessment, all that kind of standard approach stuff. Once we've identified the need for an XJ, we're then going to start preparing the area by informing the patient and getting consent if it is appropriate and necessary. So to get this patient ready, first of all, some services do encourage placing the patient in Trendelenburg for this procedures, others not so much. So use that at your discretion. So to prepare the patient for this, we're gonna slightly turn our patient's neck to the side away from where we're cannulating. So I'm cannulating on this side. So we're gonna position his head so he's looking this way. I'm going to be using a Turkle decompression needle as a substitute for an IV. Please actually use IV catheters. So we've positioned this patient's head. We're then going to, if we're having a difficult time finding the vein, we can apply some pressure just above our above our clavicle and hitting that subclavian vein and blocking it a little bit so we get some distension. If you can see the XJ or the XJ and it's really plump and juicy, then this step isn't 100% necessary. However, that can help with having it pump up. Another way to help the vein pump up is asking the patient to perform some Valsalva maneuvers. So simply closing your nose and mouth and breathing out or bearing down like you would during a bowel movement. So what our aim here is, we're going to look for the angle of the mandible and our clavicle, and our goal is to get right in the middle of the vein, right in the middle of those two landmarks. So what I'm going to do here is I'm going to hold some counter traction right here with my thumb, and I'm going to palpate the vein right here with my pinky finger or with my pointer finger, and I can feel the vein there. So I'm just going to have that stabilized there like so. I'm going to remove my catheter sheath, and at a nice 15-degree angle, we're going to be inserting into the skin and getting into that vein and cannulating. Once we have cannulated the vein, we'll then advance the catheter, remove the needle, and follow the same steps and procedure that we would doing an IV. So that would include securing it in place, checking patency, and applying a saline lock and securing it in place appropriately.